Happy to have you and ready to hear all that you have to say about what happened during the 87th legislative session in the state of Texas. Thank you.
Yeah, thank you, David. And a lot happened, and Greg alluded to some of that stuff in his presentation in the business meeting. So I'll probably I hope to go into a little bit more depth and provide a little bit more detail about all the things that did or didn't happen, unfortunately, during the 87th legislative session. But first, good afternoon, everyone. Thank you for being here this afternoon, allowing me a little bit of time to update you on things that are happening in the policy world, especially in Texas. My name is Matthew Lovitz. I serve as the Peer Policy Fellow at NAMI, Texas. In our time together today, I'm going to do my best to capture all the ups and downs of the past 10 months at the Capitol. Yeah, you heard that right, 10 months. Normally, the legislature runs from the second Tuesday in January to May 31st, so 5 months. However, this year we were blessed with 3 special sessions, the most recent ending just a few weeks ago on October 20th. How I propose to cover the action is by first setting the stage with a brief review of the financial picture heading into the 87th legislature, then reviewing the most notable mental health related bills from the regular session and each successive of the following specials. I'll close out my presentation with a look at NAMI Texas's interim activities in preparation for the 88th session that convenes in January 2023. If you have any questions while all this is happening, feel free to drop them in the chat and I'll do my best to address them as they arrive. Waiting to the end, since there is a lot of information going to be presented today and somewhat complex information, waiting to the end to address any questions that you may have may not be the best approach. And so I will take questions as we go through the material if you have one that's relevant to the things that I'm talking about. If it's not relevant, if it's just something general or more broadly about policy, we can save those questions to the end. Hopefully that sounds good. And with that, we'll go right into budgets. So I'm sure everyone by now has heard of this little thing called COVID-19. Well, in the context of policymaking in Texas, the pandemic created a significant amount of concern for the economic health of the state. Due to the public health restrictions, the state collected significantly less sales tax and oil revenue to the tune of roughly $11 billion with a B, dollars for the final year of 2020-2021 biennium. What this meant for the 87th legislature is that policymakers would have significantly less money to work with when establishing the budget, as statute prevents the state from spending more money than they anticipate to make in revenue. For reference, the estimated shortfall of $11 billion equates to almost 10% of the revenue estimate, which means that roughly 10% in less spending. In other words, 10 of every $100 was taken off the table. For mental health advocates, this is particularly troubling because it would likely lead to significant cuts in public benefit programs that largely support low-income families and individuals with disabilities. Although the forecast did improve slightly at the beginning of the legislative session, the budget picture made for a fairly bleak fall. Without a doubt, policymakers would have less to spend than during the previous budget cycle, which suggested that a few difficult decisions were going to have to be made. At the time, however, one silver lining, if you could call it that, was a roughly $10 billion stashed in the Economic Stabilization or Rainy Day Fund. Spoiler alert, this fund was definitely tapped into during the budget writing process, but policymakers weren't advertising their willingness to do so early in the session, which created additional tension at the Capitol between those who thought the conditions appropriate to dip into the state savings account and those who generally opposed doing so. So to quickly recap, dire budgetary projections layered on top of ongoing public health crisis and increased hostility between the various political factions, which I didn't mention much of, but I'm sure everybody's aware of. If not, we can cover that a little bit later in the call. Set the stage for an interesting 87th legislative session. And let me tell you, it did not disappoint. Perhaps the best encapsulation of the 87th session on the whole is to take a quick look at a few of the high-profile bills that passed that in previous sessions may not have even received a committee hearing, including legislation that permits anyone over the age of 21 to carry a handgun in public without receiving any training, a statewide camping ban for people experiencing homelessness, and changes to the school social studies curriculum that limit conversations on the history of race and racism in Texas. Naturally, these bills created a significant amount of controversy, and outspoken legislators and advocates on both sides of the aisle participated in a not insignificant amount of debate. However, it wasn't until the first special session that the drama was ratcheted up to levels not seen in Texas since the early 2000s, but we'll come to that in due time. First, let's spend some time reviewing a few of the legislative successes and setbacks of the 87th session, the regular session, that pertain to mental health. I've clustered discussion of these bills by the category in which they apply to the policy platform that was published prior to the 87th session. All right, the first grouping of bills falls under the platform category of early intervention, which, as the name suggests, applies to policies that improve access to appropriate and timely mental health care for children, adolescents, and young adults, often in primary, secondary, or higher education settings. Bills that passed include SB 279 by Senator Hinojosa, which requires the printing of the National Suicide Prevention Lifeline and Crisis Text Line on identification cards issued by public schools for students grades 6 and up, and also for students at institutions of higher education. Next, we have SB 179 by Senator Lucio, which requires that school counselors spend 80% or more of their total work time on duties that are part of the counseling program and not non-counseling administrative work. Makes sense. Counselors should be counseling, not doing paperwork. HB 290 by Representative Cortez, which was amended onto HB 2658, extends Medicaid continuous eligibility for youth under 19 years of age from 6 months to 1 year. SB 1896 by Senator Kolkhorst limits CPS's placement of children into psychiatric inpatient facilities to those who are experiencing severe mental health challenges and limits hospitalization to 72 hours beyond medical necessity. And I'll talk a little bit more about this bill because it's a little bit confusing in a second. And then lastly, we have SB 168 by Senator Blanco, which requires school districts to establish a policy pertaining to the notification, announcement, content, and impact reporting of active shooter drills. So the majority, like I mentioned, are pretty self-explanatory, but SB 1896, which establishes parameters around the hospitalization of kids in CPS custody, may need a little bit of extra explication. So first, you may have heard that DFPS or CPS in Texas has had historically a hard time finding appropriate placements for kids in their care. You may have heard stories about kids sleeping in office buildings. That is still the case. Unfortunately, what this means, though, is for CPS caseworkers, for lack of better alternatives, can or often do hospitalize kids that may be better served in the community. In instances where hospitalization is appropriate, lack of placement options for discharge often leads the kids to staying in a hospital well beyond medical need. The consequences of undue hospitalization are immense due to the restrictive nature of the setting, placing kids in close proximity to other kids who may be experiencing a crisis, and of course, the lack of educational curriculum or resources for hospitalized kids to continue their academic studies. With the support of one of NAMI Texas's PPC members with expertise on this issue, we were successfully able to advocate for changes in the proposed bill language that creates the aforementioned parameters around psychiatric hospitalization for kids in DFPS care. So previously, that limitation on our maximum a number of hours past medical necessity of 72 hours was not included in the bill. And that's something that NAMI Texas and one of our advocates had inserted into the bill. So that was definitely a big win. Notable in the early intervention category, notable budgetary items included $10 million increase in the allocation for the Child Mental Health Care Consortium and a roughly $500,000 increase in the Preparation for Adult Living program for youth exiting DFPS care. All right, despite all those successes, there are still a couple of opportunities, things that we weren't able to get done during the 87th session, including legislation that would increase access to school-based health centers, the addition of the definition of serious emotional disturbance to the insurance code, which would have in turn increased insurance coverage for serious emotional disturbances, and finally, mandated coverage for coordinated specialty care for first episode psychosis by private or commercial insurers. So coordinated specialty care is currently only available through the local mental health authorities. We were hoping to get private insurers to cover the cost of that service, but unfortunately we're not successful. So that is the conclusion of the early intervention recap from the 87th session. Does anybody have any questions regarding youth mental health that weren't addressed in this section? Or would you like maybe some additional clarification on any of the things that I discussed? If so, drop them in the chat. All right, I just want to give it a second for people to have plenty of time to input their questions if they have them. All right, seeing no questions, I will advance to the next section. Next, we have criminal justice, which, as the name suggests, applies to the services and supports available to justice-involved individuals living with mental health concerns. Notable bills that passed during the 87th session include SB 49 by Senator Zaffarini, which allows magistrates to take into consideration mental health when working with defendants living with serious mental illness. The bill also creates uniformity in the administration of outpatient competency restoration programs. Second, we have HB 1694 by Representative Rainey, which provides a defense to prosecution for the possession of controlled substances for individuals who seek medical assistance for themselves or another person who may be experiencing an overdose. You may be asking, why is this included in a review of mental health related legislation? Well, for many people with mental health concerns, they often have co-occurring substance use disorders as well. And Good Samaritan laws are an avenue for treatment or avenue to treatment for an individual with those concerns. So that's definitely good news. HB 1694 didn't go as far as we would have liked it to. It currently only applies to individuals who have never used it before, who have never sought support for an overdose. So if somebody has received a defense to prosecution for seeking support for an overdose previously, and they call again trying to save somebody's life or trying to save their own life, unfortunately, they no longer have that defense to prosecution if they are caught with any amount of controlled substances or paraphernalia on their person. We would have liked that to have been included, but unfortunately, a bill like that got to Governor Greg Abbott's desk last session during the 86th, and unfortunately, he vetoed it. So this was the compromise bill. All right, notable budget items under the criminal justice section. First, a budget rider that earmarks $1 million for peer support reentry programs that help transition justice-involved folks living with mental illness from jail back into the community. Then we have a budget rider that allows courts of criminal appeals to allocate judicial education funds to educate judges and attorneys on alternatives to inpatient competency restoration. This would be jail-based or community-based outpatient competency restoration. And then third, a budget increase in the allocation to specialty court programs to $2.2 million, an increase of roughly $400,000 from the previous biennium. All right, bills that did not pass, for which NAMI Texas advocated, included one that would allow individuals on community supervision, to engage in peer support services, one that would limit the use of administrative seclusion for individuals who are incarcerated, one relating to medication continuity for justice-involved folks with mental health concerns, another relating to a death penalty exemption for individuals experiencing a mental health crisis at the time of their capital offense, and finally, one that would allow commissioners' courts to establish regional assisted outpatient treatment or AOT programs. You can see that this is just a little bit of commentary on the criminal justice section relative to the early intervention section. You'll probably notice that the list of bills that passed that relate to mental health was significantly shorter in the criminal justice section than the early intervention section, which is unfortunately not too surprising. The nature of politics, especially politics in Texas, is such that there is not a whole lot of sympathy for individuals engaged with the criminal justice system. Although this makes NAMI Texas's advocacy work in this space a little bit more difficult, we aren't giving up. In fact, we've already got a couple bill ideas cooking for the next legislative session that have gotten a toehold with a few of our coalition partners who work in the criminal justice space. And when I say earlier, I mentioned kind of a lack of sympathy, maybe a better wording is it's a little bit more challenging to muster the political will to make significant reforms in the criminal justice system, just because for a variety of reasons, based ideology, one, of course, but also the cost associated with making big changes to these big systems. And let me tell you, Texas has a big criminal justice system. I don't know if we're the state that incarcerates the most people, but we are certainly in the top 10, if not higher in that list. All right, the third category of the NAMI Texas. Oh, I'm sorry, let me back up. Are there any questions related to the criminal justice system? If you don't have maybe the keyboard dexterity to type in a question quick enough, feel free to come off mute and ask me a question if you have need any clarification on anything that I've just talked about with criminal justice. All right, if something does come to mind, feel free to ask that question at the end when we open the floor for questions. The third category in the NAMI Texas policy platform relates to insurance coverage, coverage parity, and access to psychiatric medications. Although this isn't the most exciting issue area as it pertains to policy advocacy, it may be one of the most important, as bills that fall here can have a significant impact on access to the appropriate and timely care. Everyone living with mental health concerns or their family members are somehow impacted by the cost of care, and for many, ready access to psychiatric medications is a make or break proposition in the treatment regimen. Fortunately, we were able to champion or support a number of bills that made it past Governor Abbott's desk, including HB 133 by Representative Rose, which extends Medicaid coverage for new moms from 2 months to 6 months postpartum, HB 2822 by Representative Hull that creates guardrails around the use of prior authorizations in Medicaid programs for individuals who use antipsychotic medications, HB 2595 by Representative Price that establishes an online complaint portal for insurance consumers and healthcare providers to report suspected violations of their coverage parity rights. It's a mouthful. And SB 672 by Senator Buckingham that makes collaborative care a Medicaid reimbursable expense. So for those who aren't familiar, collaborative care is when mental health services are incorporated into a primary care setting. So a physician can seek additional support from a mental health clinician, mental health provider in the primary care setting to make sure that their patients get timely access to mental health services if the primary care physician believes there to be some sign of mental health concern going on. All right. NAMI Texas championed 2 bills that didn't quite make it across the finish line during the 87th session in this category. The first being SB 2051 by Senator Menendez that would prohibit health plans from implementing step therapy or fail first protocols for antipsychotic medications, and HB 1646 by Representative Lambert that would prevent health plans from modifying coverage benefits between plan years in instances when the enrollee maintains the same coverage. So a little bit of clarification on that one. Typically how insurance works, so say you've got an employer-sponsored health plan, you don't change your plan between plan years. So, you might get a notification from your employer say, hey, now it's time to update your plan or change your plan. This is open enrollment. You can do that. Of course, if you don't change plans, the presumption is the benefit would stay the same. Unfortunately, that's not the case. An insurer can change their plan benefit so that for somebody who maintains the same plan, their coverage may change from plan year to plan year. So say 1 week you go to a pharmacy and you pick up your medications and maybe you have to pay an $8 deductible. The next week after the plan year kicks into it, the next plan year kicks into effect, you go to the pharmacy, you may have to pay, whatever it may be, $100 out of pocket. That can be a significant obstacle for people, especially people without, huge sums of money in maintaining their mental health regimen. So the idea behind 1646 was for people who did not change their health insurance plan, that the coverage benefit could not change between plan years. And unfortunately, that one didn't make it to Governor Abbott's desk. And it's particularly heartbreaking because that HB 1646 and this particular piece of legislation, NAMI Texas has worked on for a couple of years now. And we get a little bit closer each year, and we really are hoping on getting it passed this year, but unfortunately we weren't able to do so. That said, we'll likely champion this bill again next session. And hopefully we can get it the momentum it needs to get all the way to the governor's desk and beyond. Okay, The fourth section of the policy platform, housing and other supports. As I'm sure many of you are aware, housing and employment support are an essential element in the mental health care continuum. Without either, individuals living with mental illness can experience significant barriers in obtaining and maintaining recovery. Consider the fact that mental illness is a leading cause of the onset and chronicity of homelessness. Housing is an area with no quick fixes due to cost, availability, and NIMBYism. That said, a few bills did pass during the 87th that will improve access to housing and community-based supports, including SB 500 by Senator Miles, which creates a criminal offense for operating a boarding home without a permit in counties that require permitting. HB 707 by Representative Moody that tasks HHSC with a statewide study of the availability of substance use recovery housing and opportunity to increase supply. And lastly, HB 115 by Representative Rodriguez that lowers the qualification criteria for a tax exemption for charitable organizations that provide housing to individuals experiencing homelessness. These are all good. The bills that passed are all good, of course, but we were able to get more done in the budgeting process to address the housing crisis, especially in the context of mental illness, including first a budget rider that requires HHSC to conduct a statewide study on step-down housing to divert individuals from the state hospital system back into the community. Second, a budget rider that funds the conversion of space on SSLC campuses for supported step-down housing for long-term residents of the state hospital with unique medical and behavioral health needs. And for those who aren't aware, SSLC stands for State Supported Living Center. And these are often campuses for individuals with significant intellectual or developmental disabilities who cannot live independently in the community. And there is a lot of unused capacity at these SSLCs. The idea is that we can convert some into a setting available to individuals, to long-term residents of the state hospital system who are not going to be able to live independently in the community per se, but they don't need to be in such a restrictive setting in a locked facility like the state hospital is. The last one there is a budgetary increase of more than $13 million in total funding for Section 811 project rental assistance for very low income folks living with disabilities. All right, so that's mental health capacity is the next section. But before we progress to that, I wanted to see if there are any questions about housing or employment supports. Feel free to come off mute or just tap those questions into the chat box. No? Okay, we can proceed then. Mental health system capacity. With regards to system capacity, the majority of our attention at the Capitol was paid to ways in which to increase access to telehealth services in response to serious bottlenecks in access that occurred during the COVID-19 pandemic. Access to telehealth is particularly important. Access to telehealth is particularly important to rural and frontier communities too, where the closest mental health provider may be 100 or more miles away. Accordingly, two notable legislative achievements during the 87th session include HB 4 by Representative Price, which expands access to telehealth services within Medicaid, and HB 5 by Representative Ashby that establishes a broadband development office that will conduct various activities to improve broadband access in rural and remote communities. Jane, yes, we will provide the slides, I believe. If not, the video will certainly be available. In the same vein, SB 454 by Senator Kolkhorst requires the continuation of regional work groups to strategize ways in which to reduce the cost of providing mental health care, including costs related to transportation, incarceration, and emergency room utilization, which are particularly costly in rural and remote communities. And lastly, HB 3088 by Representative Coleman that lowers the amount that counties have to put up in order to receive state grants that fund certain kinds of mental health services. And this bill is particularly designed to support communities with fewer financial resources, many of which are outside of urban centers. So for those who aren't familiar, there are grant programs provided by the state to local mental health authorities where they have to put up a certain amount of funds in order to qualify. Say it's like a 50% match. So if there's a $100,000 grant out there, the local mental health authority has to have $50,000 in order to even qualify for that grant. Representative Coleman's bill, what it did was lower the threshold, or lower the match for some of those, for those LMHAs so they could still apply for those grant funding. So it went from like 50% down to 25%. So the difference between 50,000 and 25,000 obviously is pretty significant. If it's even larger grant, say it hundreds of thousands of dollars, the difference between $200,000 and $100,000 is certainly significant, especially for those rural or remote communities without as many financial resources. On the budget side, the legislature approved roughly $400 million for state hospital redesign and expansion projects that will improve capacity at the state hospitals in Austin, San Antonio, and Kerrville, and establish a new state hospital in Houston. The legislature also provided $15 million increase in the budget for private community-based inpatient beds to improve access to individuals who don't need a long-term hospitalization. So 7 to 10 days should be enough to stabilize them. So HHSC put more money into that budget line item, which is certainly a good thing. All right, bills that we weren't able to help across the finish line include all things related to the provision of peer support services. There were a number of those bills, and they're listed there on the screen for you, including allowing recovery community organizations to bill Medicaid for the delivery of peer support, making certified family partner services Medicaid reimbursable, allowing them for Medicaid reimbursement for peer services provided to individuals with IDD, and lowering the age eligibility criteria to receive peer services from 21 to 18. We also proposed a budget rider that would have increased Medicaid reimbursement rate for peer services, but it wasn't included in the appropriations bill, unfortunately. All right, we're getting close to the end of our section, so bear with me, only a little bit longer. The next section we have here is targeted populations, and when we say targeted populations, we think of populations often associated with minority groups. And so this is communities of color, individuals or communities who identify as LGBTQ, and those experiencing poverty, as well as veterans. Unfortunately, the only group with which we were able to make any significant headway in terms of policy was the last one mentioned, and that's veterans. For example, the legislature passed HB 3821 by Representative Hunter, which requires HHSC to collaborate with the Texas Veterans Commission to develop and administer mental health programs tailored to meet the needs of veterans. SB 1093 by Senator Creighton that allows for greater flexibility in the supervision of veterans participating in specialty court programs. And HB 1802 by Representative Dominguez that requires DSHS and the Texas Medical Board to conduct scientific study on the effects of ketamine, MDMA, and psilocybin in the treatment of PTSD. Let me see here. Okay. But bills that didn't make it through the legislative process in this category of targeted populations include SB 147 by Senator Powell, which would have created a pilot program to address maternal mortality with the provision of peer support services. HB 4319 by Representative Coleman that would have established an Office of Health Equity at HHSC. HB 1298 by Representative Bernal that would have required employers to provide certain employees paid sick leave. SB 91 by Senator Menendez that would have added PTSD to the definition of serious mental illness and, by extension, improved insurance coverage for the treatment of PTSD. And finally, a slew of other bills that would have improved the quality of care provided to LGBTQ plus Texans. So earlier in the call, I mentioned the disparities, discrepancies in bills passed for early education and criminal justice, and mentioned that criminal justice reform is a little bit harder to get passed. And I would say the same applies to the targeted populations, with the exception of veterans. In political science terms, veterans are it's very sympathetic. It's easy to be sympathetic for that population and pass policies to improve the kind of quality of care provided to them in terms of mental health. Communities of color, people who identify as LGBTQ, these aren't necessarily less sympathetic, but it's a little bit harder to make the gears of policy turn in favor of those groups, unfortunately. And that can be attributable to a number of different things. I mean, Texas is a very conservative state. And sometimes it's a little bit more challenging to get policies enacted that redistribute resources from certain groups to those minority groups or less advantaged groups, unfortunately. And we could certainly talk a little bit more about political science or policy theory. If you have questions about why that is specifically, I can certainly do my best to address those questions at the end. Needless to say, it's unfortunate, and NAMI Texas is going to continue to advocate for those minority groups to help them get the resources that they need, so they can maintain a high quality of life and get treatment, access to treatment that they need for mental health or primary care. All right. The last category, yes, the last category on our policy platform for the 87th regular session was crisis services and suicide prevention, which is kind of a mixed bag of successes and opportunities. Bills that passed mostly relate to services for first responders, such as law enforcement and emergency service personnel. These groups are viewed much like veterans, very favorably, which include SB 64 by Senator Nelson that requires HHSC to establish a peer support program for peace officers, SB 1359 by Senator Hughes that requires law enforcement agencies to develop policies pertaining to mental health leave, and HB 788 by Representative Guerin that extends access to the specialty treatment court programs available to police, firefighters, and jailers be granted or extended access to emergency service dispatchers as well. Another notable legislative success was the passage of HB 3121 by Representative John Turner that establishes a voluntary certification for long-term inpatient psychiatric facilities for youth in instances when an adolescent is not ready to return to the community after a 7 to 10 day crisis stabilization at a quote traditional inpatient psychiatric facility. So these would be a long-term residential facility. These facilities don't currently exist in Texas, or they're not well documented to exist, and most people have to send their children out of state for that 30 or 60 or 90 day less acute inpatient placement if they're still not ready to return home after they've been stabilized from a mental health crisis. All right, we had one notable budgetary success too in the form of a budget rider that directs HHSC to study the adequacy and efficacy of the existing National Suicide Prevention Lifeline infrastructure ahead of 988 rollout in June 2020. Excuse me, June 2022. As for bills NAMI Texas championed, and that didn't pass during the 87th legislature that pertain to crisis services and suicide prevention, many of which will be opportunities in the 88th. One of which would have required educators to complete suicide prevention training every 2 years. Another would have allowed police to seize firearms from people they deem to be at risk of harm to self or others. Another would have streamlined data collection or reporting on jail diversion by peace officers. And one more would have clarified the inpatient commitment criteria for individuals experiencing a mental health crisis. All right, so we've covered a lot of information, so I'll do my best to be as brief as possible with what happened over the 3 special sessions. First, I'm gonna take a quick drink of water, excuse me for a second. All right, and in the interest of being brief, we're lucky because during the first special session, only lasted about a week until Democrats left and broke quorum and went to DC to lobby federal legislators for voting rights legislation. This is in response to bills that were working their way through the Senate that would, in the view of many Democrats and many Texans, would have stifled voter rights to a certain extent. And we'll talk a little bit more about that when we refer to the second special session, which is right about now. When quorum was reestablished halfway through the second special session, the legislator made haste to move SB 1 by Senator Hughes, which is that voter integrity is what they're calling voter integrity legislation, which created significant revisions to the elections code. With respect to the bill's impact on individuals living with mental illness, NAMI Texas was particularly concerned with provisions that limit who can assist voters with disabilities, such as serious mental illness. The second provision of concern was one that provided election observers new freedoms that many may consider to count as voter intimidation. Unfortunately, despite opposition from diverse community groups, including NAMI Texas, SB 1 passed and was signed by Governor Abbott. In addition to SB 1, SB 6 by Senator Huffman was passed and signed during the second special session, which made a few changes to the bail system in Texas, including prohibiting granting of bail to individuals who commit certain violent offenses, despite how mental health may have influenced or impacted the offense. The bill also prohibits bond for individuals who have a history of failing to present to court on a previous bond, which again also often happens for individuals with mental health concerns who may not have the resources or the ability to show up to court after being bonded out, unfortunately. We shared our concerns with the legislature, but unfortunately those SB 6 did pass pretty quickly too. There was a lot of opposition to SB 6 as well, but it was one of those priority bills that was not going to be stopped regardless of the opposition. All right, in the third special session, a couple of things happened related to mental health. I'll start with the good news. Policymakers debated and passed legislation that allocates $16 billion with a B dollars from the federal government in response to the COVID-19 pandemic. This is also known as the American Rescue Plan Act. Notable investments include $113 million in the Texas Child Mental Health Care Consortium to expand access to services for youth experiencing mental health concerns, as well as to add access to services for pregnant women and new moms. $238 million to complete construction on the state hospital in Dallas, on top of the roughly $50 million that was allocated during a regular session to begin the planning process. And lastly, about $40 million for a 100-bed behavioral health care center in the Midland-Odessa area of West Texas. The bad news is that the legislature also passed HB 25 during the third special session, which is by Representative Swanson, which prohibits transgender girls enrolled in public or charter schools from participating in team sports that align with their gender identity. In our view, this is a bad news because of the well-documented mental health concerns experienced by this group and the potential benefit of being allowed to participate in team sports. We're also concerned about the impact of the whole conversation around transgender sports bans, as it may single out these already vulnerable kids and create or worsen mental health concerns. Really unfortunate. All right, this is the last section, I promise, of me talking at you at least, and then we can go into open conversation if you guys do have any questions about policy, what's happened, what will happen in the future. I'm certainly able to address those. But first, we're going to talk a little bit about the interim. All right, in the interim, which is the period between legislative sessions, NAMI Texas will engage state agencies that are responsible for implementing bills passed during the 87th, as well as setting rules for programmatic change. And we will also work with the legislature on interim charges that can shape legislation during the 88th session. With respect to the first, which is bill implementation, NAMI Texas routinely engages with HHSC in the bill implementation process. The most notable example may be NAMI Texas' participation in the rollout of the nationwide 3-digit mental health crisis number 988. I mentioned earlier that in collaboration with a couple coalition partners, NAMI Texas developed budget rider language that requires HHSC to study and report the adequacy and efficacy of existing crisis lifeline infrastructure prior to the rollout of 988. While HHSC does this work, they've also developed a task force to provide peers, their family members, mental health providers, and advocates the opportunity to provide input on key planning considerations prior to rollout. The task force is led by the Texas Suicide Prevention Collaborative and includes stakeholders like HHSC, the LMHAs, disability rights, various municipalities, and of course, NAMI Texas. With regards to rule setting, interim engagement includes providing testimony to HHSC on Medicaid reimbursement rates for certain services, testifying to the Drug Utilization Review Board, which informs discussions on HHSC's medication formulary for Medicaid prescribing practices, and participating in HHSC's Behavioral Health Advisory Committee, which provides a forum for community stakeholders to engage with HHSC on various issues related to mental health and substance use services around the state. With regards to rule setting, I mentioned providing testimony to the Drug Utilization Review Board. I did that just yesterday, as a matter of fact, where I went in and advocated for open access or ready access to provider prescribed antipsychotic medications. So, and I mentioned this earlier in the conversation, that prior authorizations, step therapy, and a number of other non-clinical formulary restrictions inhibit access to medications for individuals with mental health concerns. So I went before the Drug Utilization Review Board yesterday and said, hey, this is not good. This delays access to essential medications for people with serious mental illnesses. And we highly suggestive the Drug Utilization Review Board and Medicaid programs by extension considering removing those burdensome prior authorization requirements so that individuals with these conditions are able to get access to their medications in a timely manner. The benefits are, of course, improved treatment outcomes, improved employment opportunities, family or community stability, et cetera, et cetera. So that was a really cool experience. And those are the kinds of things that NAMI Texas does on a fairly regular basis to engage HHSC in these conversations about how to improve the care we provide to individuals with mental illness. Concerning, thank you, Melissa. Concerning that last bulleted item there, interim charges, NAMI Texas has provided study language to a few legislative offices regarding issues that weren't addressed or fully addressed during the 87th session. Let me back up and just tell you a little bit about interim charges if you're not familiar. Interim charges, basically what they do is that they direct the legislature to call stakeholders or convene stakeholders to discuss issues of relevance to the state of Texas. In the world of mental health, what one example interim charge we've put forth for the interim before the 88th session is a study on access to peer support services. Previously in this conversation, I mentioned that none of the peer services bills advanced during the 87th. So to hopefully engage the legislature in those conversations to advance the conversation a little bit and figure out ways in which to improve access to peer support or certified family partner services, we have submitted interim charge language to legislators who then in turn submit it to their committees, and hopefully it will be accepted. And then we'll have an opportunity to bring various stakeholders together and have those conversations on record in front of the legislature, and so they can take action during the 88th session. I'm happy to report that that peer services charge that NAMI Texas did develop in collaboration with the Hogg Foundation was submitted to the chair of the Public Health Committee yesterday by Representative or Chair for Price from the Abilene region. He has been a pretty outspoken advocate for peer services, and he was a natural fit for that charge. And we're happy to report that after conversations with his office, they did submit it to Chair Click's office for consideration as an interim charge. A huge success. That said, there are a couple other interim charges that we haven't received a final word on or haven't been picked up or submitted to their committee chairs. From what we understand, we have until November 22nd, which is next Monday, or I guess the following Monday, for those charges to be submitted. So over the next week or so, we have like 3 or 4 charges that we're still trying to get placed with offices. And so we'll be hitting that pretty hard and trying to get more opportunities to advocate for mental health services prior to the 88th session. And hopefully that will lead to more favorable outcomes during the 88th session with legislation that improves access to mental health services and supports. All right. With that, I'm fully parched. And I think I've thrown enough information at you for the time being, but I'd be happy to discuss any of these initiatives or issue areas. If you do have any questions, please feel free to come off mute or drop your questions in the chat, and I'll be happy to address them.
Yeah, and like Matthew said, you can come off mute and ask questions or drop them in the chat. But so far, Matthew, we haven't gotten any questions in the chat. Just a lot of praise for all the amazing work that you do.
Yeah, that's exactly what I was going to say, Matthew. Great presentation, a lot of detail. Appreciate all the hard work that you and the staff have been doing this year. Just phenomenal. Can't say enough praise for you guys. So thank you for the presentation for sure. And hopefully if anybody else has any questions, that's great. I just wanted to make sure that I gave you the praise that you guys deserve.
Oh, well, thank you. Greg has certainly been a tremendous supporter and teacher. As he mentioned in the business meeting, he was doing this for like 7 years prior to stepping up to executive director. So he's left some big shoes to fill, but fortunately he's been there the whole time and providing excellent guidance and support throughout the process. And of course, we've been blessed with a few interns that are really excellent and really motivated to make changes in this area as well. And so it's been a pleasure, and it's been really easy, as a matter of fact, to make some headway, hopefully, with all the support I've received. So it's been really great experience.
I thought I saw Melissa's hand go up, but it looks like it came down. I don't know if Melissa, it says Melissa's iPad. I wonder if you had a question. Okay. Okay, that was applause. Okay. Yeah, so yeah, definitely thank you so much, Matthew. Working at the legislature is a very difficult task. There's just so much movement and so many things to follow, and so much to understand. It's such a complex process, and really great overview of what happened. As a former Senate staffer myself, I applaud your breakdown here. You really made it easy for, I think, folks to understand all that went on, and the good things and the bad things, and also what we can expect. So thank you so much. I don't know if there's anybody else that has any questions. I see. Okay, looks like there's one in the chat from Jane Mellon. What can you advocate to help heed Don Jillison's call for more BIPOC workforce and peers in CIT teams?
So those may be two different questions. So for a more diverse workforce, there's a lot of discussion and momentum around workforce shortages right now. This is something that's been brought to bear during the pandemic, and it was made very clear that people in underserved communities had even less access than previously known. And so what there's a lot of conversation around now in terms of increasing workforce for mental health concerns, and specifically BIPOC providers, is through, for one example, is like a student loan repayment program. There is a student loan repayment program in place already in statute. However, it's been long depleted. So we're trying to get more money into that program to pay student loans for people who go and work in rural or remote parts of the state and provide mental health services. There are also some initiatives to draw more diverse communities, more diverse students into helping fields, just through some education and outreach initiatives, more or less, to engage those communities in those conversations, to draw more people in and emphasize really how important they are into those conversations. This may not be something that you're aware of, but in helping fields, the majority of providers are white women. Like 80%, if not more, are white women. And obviously that creates a significant opportunity, because the majority of people who utilize the public mental health care system are people of color from lower socioeconomic status, who may not necessarily be able to easily relate to white women, or vice versa. White women may not be able to provide the best support to those particular communities. So there is a huge push to draw in more people to the helping fields, more diverse individuals into helping fields, and to kind of shore up resources in those remote communities. That is happening legislatively. On the CIT front, or crisis intervention team front, what we're hearing a lot of now is CIT teams, or what we'll call, I guess, those are all police, all law enforcement. So multiple law enforcement people going out on a team together who have specialized training in mental health de-escalation or mental health crisis de-escalation. Obviously an important part of the mental health care continuum. There's also a lot of conversation around integrated crisis response teams that include law enforcement, mental health providers, and EMT. Dallas has the Right Care program. Harris County has a similar program. And also I think Bexar County has or is developing a similar program. There's a lot of emphasis lately on getting law enforcement out of crisis response to the greatest degree possible. Law enforcement obviously is important for ensuring that the scene is safe. In the event that somebody is at a risk of harm to self or others, there is value of having a law enforcement officer there, but once they're able to establish safety, taking them out of the equation to the greatest degree possible and making sure that person has access to medical care and mental health services. That's where a lot of the conversation is right now in the state of Texas, at least from my perspective. And that's where I think there's the greatest opportunity, because those integrated crisis response teams are largely local initiatives that are funded by local taxpayer monies, and there's no statewide plan for how to increase utilization of these programs that have a very significant and known benefit. So how do we help other localities that don't have these integrated teams or don't have the resources to develop them? How do we help them start to implement these important tools? And those are some of the conversations we're having currently, and that NAMI Texas is engaged in. We did I mentioned interim charges later, so NAMI Texas, in collaboration with the Texas chapter of the National Association of Social Workers, and also the Texas Council on Community Centers, which is the trade organization for all the LMHAs, did collaborate on some interim charge language around crisis response, how to increase access to integrated crisis response, and ways in which to prepare for the rollout of 98 by making sure there's more mental health resources in those rural or remote communities to make sure that there is an opportunity for mental health providers, not necessarily exclusively law enforcement, to be providing that support that's needed. So right now, that's kind of what we're doing, is we're trying to place that interim charge language, and we've heard from a couple offices that are strongly considering it. We haven't received 100% definitive response just yet. We still have another week or two, so hopefully we do hear something more on that shortly.
Thanks, Matthew. I think there's another question in there from Andrew Lowe. It says, you touched on this in one bullet, but please elaborate. Marijuana, mushrooms, etc. What is the NAMI Texas position and strategy on substances legal for veterans with PTSD, illegal for non-veterans with PTSD, or medical uses of certain substances?
Yeah, so I forget the bill number, but I know what you're talking about. It's the clinical study on the use of MDMA, psilocybin, and ketamine on the treatment of PTSD in veterans. Initially, that bill was targeted for just the treatment of PTSD, but they had to narrow it down to veterans to make it a little bit more palatable, I think, for the governor. Because as I kind of alluded to throughout this conversation, veterans are they're viewed very favorably in terms of policy. They're a very sympathetic group of people. So it's easier to get legislation passed for groups that are viewed very favorably by the conservative majority. Veterans, law enforcement officers are amongst that group. With respect to the science, this is like new and burgeoning field in the use of psilocybin or these alternative therapies or therapeutics to treat PTSD. And so I think some states have already started pilot programs, if I'm not mistaken, but there is some research and certainly can access ketamine. If you're like a private pay, you can go to a ketamine clinic and get ketamine for your mental health concerns. But what they wanted to do, Texas wanted to do here, is to see if there's an opportunity to make this improve access to these like novel therapeutics for a population who experiences PTSD at higher rates than maybe the general population. And so they singled veterans out here. But again, this is just a clinical study. This is not necessarily, we're guaranteeing that this is going to happen, but they're just going to do a study on a small sample size to see if there is a proven benefit. It will largely mirror probably all those national studies that have shown there is. And then what happens next, we'll have to see. With regards to the legality of it, I can't necessarily speak so much to that. I think NAMI Texas' position is that we're certainly open to all these interventions. Anything that's going to improve access to treatment for veterans or non-veterans, anybody with PTSD or any mental health condition, novel treatments are certainly a good idea. This is how we innovate and stay ahead and develop new ways in which to support individuals who may not have responded well to the more traditional or conventional treatments. I apologize, my dog's in the background. He's snoring awfully loud, so if you can hear that.
Well, thank you again, Matthew. I don't know if anybody else has any other questions that they'd like to drop into the chat. You can wait a couple of minutes to see if anybody else has any questions, but I can add a little bit on the question, advocating for CIT teams. I work at the county level, and El Paso County has just started a CIT program, you know, I think we're you know, I think the advocacy is, it's important to advocate at the local level within your city police or your city council and your county commissioners courts, because as Matthew said, that's typically where the funding is coming from. We've been able to get some federal funding as well as some state funding through our local mental health authority and through our congressperson. But you know, it's the majority of that funding comes from either the commissioner's court or the city council. And you're right. I think that we're actually looking to the trend is to you know, try to take law enforcement almost out of that situation. And one thing that we're talking about here is having folks at our dispatch that are mental health professionals, and the way they can, you know, when calls come in, if somebody's having a crisis, calls come in, and they can actually, you know, direct either a CIT team, or maybe if other teams are created that don't have actual law enforcement officers embedded with those teams, they can direct those folks to deal with those crises. But really great great things happening in that area, I think, all over the state.
For sure. And we have a similar program in Travis County in terms of mental health clinicians integrated into the call center, the 911 call center, to direct for the dispatchers direct mental health related calls, and hopefully divert people from justice involvement and get an MCOT team out there. Definitely any and all opportunity to incorporate more mental health services and less law enforcement is
Right.
welcome.